start this. Okay, so we're open and we already have some people rolling in. Hello, everyone.
Hey, everyone.
So we are starting our pelvic health webinar from Nobleton Physiotherapy and Aurora Sports Med. We've got people pouring in. We're gonna start around 7:30, everyone. I'll just draw your attention if you're starting to sign in towards the chat at the bottom. So please feel free to pull it up. And if you want to chat with everyone, just set the drop down to all panelists and attendees, and we'll start to communicate in there. So how is everyone doing? Where are people calling in from? I'm currently in Aurora. Nadine, where are you at?
I am in Bolton, actually.
Bolton, all the way up there.
Yeah, but I work in Nobleton Physio.
There you go. Where are you guys coming from? Let's type it in the chat there. Innisfil, Kincardine? I've never even heard of that. Is that in Ontario? Have you heard of that, Nadine?
No, I definitely have not.
That's it correctly. We've got a couple out in Bolton with you, Aurora, Nobleton, King City, Newmarket. That is awesome. Thank you guys so much for joining us tonight. Oh, a couple from Scarborough. Awesome. Schaumburg. Off Lake Huron, near Goderich. So, Debbie, I've never been. Maybe I'll check it out one of these days. Awesome. So we've obviously run some of these webinars before on a bunch of different topics. We've talked with Dr. Gamble about osteoarthritis, done some on vestibular rehab. Have you guys joined in our other webinars, or is this your first webinar with the team? Just give us a type in the chat. If this is your first time, just rate first time and let us know. Oh, first time. Welcome, John. Dr. Gamble, awesome. First time. Very good. Welcome. Well, it's tons of fun. We've got a really good presentation for you tonight. Nadine has done an awesome job, and there's a lot of really valuable information coming.
Yeah, we'll have lots of polls. You guys can go through myths or facts. It's going to be lots of fun.
Awesome. Welcome to all the first timers. Veterans, are you out there? Webinar veterans, type in the chat now. Let us know. We still have people pouring in. First time. Very good. Okay, couple minutes away. So I'll reiterate this in a couple minutes, but just for those of you that are here, obviously you figured out the chat function, which is awesome. So please feel free to type any questions that you have into the chat box while the webinar is going on. I'm going to keep track of all the questions that come through, and we're going to wait till the end of the presentation to kind of address all the Q&A, but please type it in and I'll respond to you that I've got your question. Just a note that if you don't want to let everyone know your question, you can change the drop-down menu in the chat just to myself or even just to Nadine, and then we'll get to you guys that way if you want to be more anonymous. Other option is we do have the Q&A function at the bottom. You can always throw a question in there that can be anonymous as well if you would like it to be. Jennifer, still learning. So are we. We're always learning as physiotherapists. We're always trying to broaden our scope and be able to help our patients in the best way that we can. So we're learning with you guys.
Yeah, for sure. And Erin, when they ask their questions, do you prefer them to type it in the chat or do you prefer them to type it in the Q&A box?
Wherever you guys would like. I'm going to be all over this chat box and Q&A, so I'll do my best to pick it up. If you find your question, if I didn't address you or you're not sure, just shoot me a message and I'll confirm that I've got your question. Okay? So we are getting close to that 7:30 mark. We still have some people pouring in, so let's give it another minute or two. Get started here. Anything else I need to warn people of? I think that's pretty well it. We've got the chat and Q&A. Those are the main things to keep your eyes peeled to.
If you guys are excited to learn about pelvic floor physio, type in yes in the chat.
I'm excited.
You're excited. Good. Yes, yes, yes. Yay.
Awesome.
Yeah, good.
So many exclamation points.
I know.
Celebratory emoji. How are we handling the mute function, Nikki? So all the participants, you guys, your mics will automatically be muted, so don't worry about that. We'll handle questions just written in the chat. That'll just be the easiest way for us to tackle them. Okay? No problem. Okay, guys, so we're pulling up just past 7:30, so I think we should get started. I'll reiterate for those who are just signing in, 2 functions to look at the bottom. We've got our chat box. Use the drop-down menu. You can set it to just panelists or to everyone. So if you're asking a question, you want to be more anonymous, please feel free to set that just to the panelists. We also have the Q&A function at the bottom, so that is an option as well if you'd like. And that's pretty much it. So this is going to be a really fun night. So thanks, Nadine, for joining us. My name is Erin. I'm one of the physiotherapists at Aurora Sports Medicine Professionals. I'm currently taking my pelvic training and will be taking on pelvic health patients probably in the new year. So stay tuned for that. And I'll let Nadine introduce herself and kind of get started here.
All right, thanks, Erin. So just want to say hi to everyone that's here and thank you for joining my webinar on pelvic health. This is a topic that I feel really, really passionate about, and I'm so excited to share my knowledge with you. I really hope that you guys do learn a lot. So let's get started. So just a little bit about me. So my name is Nadine. So I am a registered physiotherapist and I'm specialized in pelvic health physiotherapy. I've been working at Nobleton Physiotherapy for over 5 years now. And for those of you who are joining us maybe from the Aurora Clinic, Nobleton Physio is a sister clinic of Aurora Sports Medicine Professionals. So throughout my career and throughout, even just university and life, I've always had a passion in women's health. So pelvic physio was such a great way for me to combine my orthopedic skills and women's health together. So let's go through just a quick outline of what we're going to talk about today. So we're going to just talk about, what is the pelvic floor? What is pelvic floor physiotherapy? We're going to talk about some causes of pelvic floor dysfunction, the facts about Kegels, some common conditions that we actually can treat. So that includes incontinence, that includes pelvic organ prolapse. And we're going to go through some pelvic floor conditions that we'll find in pregnancy, postpartum, and menopause, and why pelvic physio is so important throughout these different stages of life. And then I'll walk you through an assessment and treatment and what that will look like. And then we'll do our live question and answer at the end. So for those of you who are just joining, if you do have questions throughout the presentation, please feel free to put them in the question and answer chat box, and all the questions will be answered at the end of the presentation. All right, so let's get started. We have our first poll. So we just want to get an idea of who's here, who's watching. So the first poll that's going to pop up on your screen is, what age category are you in? And then you can just submit your answers, and then we'll kind of see. There we go.
Awesome. So the poll is live, guys. So take a peek at that. We will share the results. We'll give it a few more seconds.
Yeah.
Also, Sue, just to answer your question, probably about an hour or so.
Okay, perfect. Looks like most have voted. All right, so we have a little bit of a mix, which is awesome. And so let's go to the second poll. So what brought you guys to this webinar on pelvic health? So the answers can be, you've maybe been recommended to see a pelvic physio, you want to know if pelvic physio will help you, you're interested to learn about the pelvic floor, or maybe you're not sure why you're actually here.
Awesome. So lots of answers coming in. Only 4% not sure why they're really here. So that's good.
We got one person saying that.
No, you're going to learn why you're here.
Exactly.
Okay, so let's end that poll. Here are the results.
Perfect. Okay, so majority of you are so interested to learn about the pelvic floor. And so honestly, guys, this is going to be really informative, and I really hope you enjoy everything we talk about. If there's any topics that maybe I don't get to and that you have questions, please feel free to answer, and we can always connect one-on-one after the presentation. I'll be giving you my information, and we can always talk about any personal questions from there as well, okay? All right, so let's move on. So what is pelvic health physio? It's kind of a main question that people are like, maybe they've heard of it, maybe they haven't. So really what it is, it's the assessment and treatment of various conditions that involve the pelvic floor, muscles, and the surrounding areas. So basically we treat everything that's below the belt. And our goal through pelvic physio is that we are trying to improve pelvic floor function through exercises, lifestyle modifications, education, and we do a lot of hands-on treatment to eliminate any symptoms that you might be having. So then the next big question is, well, what exactly is the pelvic floor? So let me tell you. So here I have my pelvis here, and as you can see, as we tilt the pelvis, you can see all of these muscles that line the inside of the pelvis. So they attach around, they attach to the front of the pubic bone, they attach to the sacrum and to the tailbone. And so these muscles are forming like a basket, okay? And so they have 4 really important functions. So the first one is that they give us support. They support our organs against gravity and intra-abdominal pressure. So inside of that basket, you have your bladder, you have your uterus, you have your rectum, and they're all sitting inside. And when there isn't support, that's where we run into a problem called pelvic organ prolapse. And I'm going to be talking about that in more detail coming up. Second main function is that these muscles are sphincters. So they will contract and they will relax, and they are what help us maintain our urinary and bowel continence. So they help us to hold in our pee and our bowels and let them go when we want. Third function is that it offers us stability. So it assists in stability of the spine, the sacrum, and the hip joints. And how it does that is because the pelvic floor muscles are a part of our deep inner core muscles. And I'm going to talk about that in the next slide in more detail. And then the fourth main function is that it gives us sexual function for orgasm and blood flow. Okay, so let's talk about our core. So we have our inner core and we have our outer core. So your outer core here is your six-pack abs, your rectus abdominis. If you're doing crunches and sit-ups, these are the muscles you're training. However, to have a strong core, we have to actually strengthen our deep inner core muscles. And those muscles are our pelvic floor, our transverse abdominis, which are the deep inner ones underneath the rectus abdominis. We have our diaphragm, which is our breathing muscle, and we have our multifidus. So these 4 muscles are what come from our abdomen and they wrap around the spine, and they are what give us our stability and support. So when we talk about having a strong core to have a strong back, it's actually these inner core muscles that we need to train before we start to train our outer core. And so that's why these muscles play such an important role for us. So to kind of summarize that, we need proper strength, length, and coordination of our pelvic floor muscles and inner core in order to avoid dysfunction. So when we have imbalances, these can lead to pelvic floor dysfunction and some of the common conditions that I'll be going over today. So some causes of pelvic floor dysfunction. Now, these are just some examples, not an exhaustive list, but you can see here that pregnancy, labor, and delivery, we're gonna get overstretching of the pelvic floor muscles. They can get injured, they can weaken during these times. Constipation, if you're constantly straining and pushing all the time, that's gonna put a lot of pressure on your pelvic floor muscles as well. Menopause. So during menopause, we have all these changes in our hormones and estrogen, and so that can lead to changes in our tissues as well as our pelvic floor muscles. If you do a lot of heavy lifting, if you're overweight, that is going to put a lot of pressure on your pelvic floor muscles as well. If you've had any abdominal surgeries like a C-section, hysterectomies, all of those can affect your pelvic floor muscles as well. So let's talk about some common conditions. So again, this is not an exhaustive list of what can be treated, but these are some of the common things that we can see and that what we're going to kind of talk about today. So first off, we have incontinence. So that's where we have urinary and bowel, the ability to be able to hold in our urine and hold in our bowels, or the loss of that. We can treat constipation. We can treat pelvic organ prolapse. We can treat genitourinary syndrome of menopause. We can treat pregnancy and postpartum related issues such as diastasis recti, C-section scar adhesion, vaginal tears, episiotomy pain. And if you don't know what all of these are, we will be talking about them in detail, so don't worry, stay tuned. On the right side of the table here, we have pelvic pain conditions. So pelvic pain can come from a variety of reasons. The first one that I have on the list here is pubic symphysis dysfunction. So what that is sometimes women will get pain right on the front here of their pubic bone. This tends to happen a lot in women who are pregnant, or if they've had a baby, or in high-level athletes. We have coccydynia, which is tailbone pain. So again, if you remember, I said that those pelvic floor muscles attach right onto your tailbone. So if you've fallen on your tailbone, if you've given birth and you were pushing really hard and you injured that tailbone, you could get tailbone pain, and it can be treated through pelvic floor physio. A lot of women will have chronic low back pain. So a recent study that was done actually surveyed women with chronic low back pain and found that 90% of those women actually had pelvic floor dysfunctions. We have dyspareunia and vaginismus. This is where we have pain with intercourse. 1 in 4 women will experience pain with intercourse at some point in their lives, and that can be due to various reasons, but this can be treated and it can be helped. We have vulvodynia, so that's just pain on the vulva. There's endometriosis, interstitial cystitis, which is painful bladder syndrome. So again, not an exhaustive list, but some of the common things that we do see. And again, if you have any specific questions regarding these, we can always chat at the end about them. Okay, so oftentimes I get the question, well, can't I just do Kegels? My doctor told me to do Kegels and it's going to solve all my problems. Well, actually, not exactly the case. Kegels are not always indicated for pelvic floor problems. And the reason for this is that pelvic floor dysfunction is related to either weak or tight pelvic floor muscles. So if someone has a true weakness in those muscles, then yes, Kegels are the answer. But oftentimes, women are actually, and men, may not be performing them correctly. There's a specific sequence to it. You have to make sure you're breathing with it. You have to make sure you're not over-recruiting other muscles. So it's really important that you learn the proper way to do a Kegel. In the case that we have a tight pelvic floor muscles, or what we say they are overactive, hypertonic, what that all means is that your pelvic floor muscles have tension in them. And if you're trying to tension and tighten a muscle that's already tight, that's only going to put further tension on it, and that's actually going to make your pelvic symptoms worse. So in a case like that, we do not recommend that you do Kegels. Examples of this are people who may have pelvic pain, pain with intercourse, constipation. A lot of those are signs of tension and times when you should not be doing Kegels. So how do you know if you are weak or if you have tension? It's through an internal exam by a pelvic floor physiotherapist. We'll assess the muscles internally along with the symptoms that you are experiencing, and then we'll actually tell you whether or not Kegels are appropriate for you to do. Hope that makes sense. Okay, so let's move on to some of the common conditions. So the first big one is urinary incontinence. So to be continent means that you can hold your urine or your bowels in, and you can choose when to let it go. Therefore, incontinence is the loss of that control. So urinary incontinence is a loss of bladder control. 1 in 3 women will have some form of incontinence in their lives, and this is more likely to occur from childbirth and menopause. However, it's not limited to those times. We can experience this and these symptoms at any age and for various reasons. So we have 3 main types of urinary incontinence. So the first one is stress incontinence. So this is where one might have loss of urine secondary to an increase in intra-abdominal pressure. So that's when you cough, you sneeze, you laugh, heavy lifting, you might be exercising, jumping on the trampoline, and you might get some dribbling or some leakage with it. The second one is urge incontinence. So this is where you have that really strong, uncontrollable need to void. You got to run to the bathroom. You can't hold it in. Sometimes you make it and sometimes you don't, and you may lose some urine at that point as well. And then we have overactive bladder. So that's where you have that sudden urgency that you really, really got to go. You have an increased frequency. So you're maybe going to the bathroom every 15, 20 minutes. And then you have nocturia, which is where you're waking up frequently in the middle of the night to go pee as well. So we have grade 1 level evidence. We have research to show that pelvic floor muscle training is our first line of treatment that can be done conservatively to help alleviate these incontinence symptoms. So let's talk a little bit about the bladder. So what are considered normal bladder habits? So first, you should be peeing about 5 to 8 times a day. You should not be peeing in the middle of the night. We say maybe it's okay, 1 time a night if you're over 55 or if you're pregnant. You should be going every 2 to 4 hours. Your urine stream should take about 8 to 10 seconds, and your urine should be pale lemonade in color. So if you feel like you fall out of these parameters, I want you to know that the bladder is a muscle, and it can be trained in conjunction with your pelvic floor muscles to alleviate any of your incontinence or bladder issues. Okay, so we're gonna go to our first myth or fact. So the poll is gonna pop up, and I want you guys to answer whether or not you think this statement is a myth or a fact. So a good way to do Kegel exercises is over the toilet while you are peeing. So that is as you're peeing, you're stopping and releasing your flow over and over as an exercise.
Awesome. Thank you guys so much for filling out the poll. So we still have answers coming in, so we'll give it another 10 seconds here. Don't be discouraged about voting, guys. Your votes are anonymous, so don't worry. We're all here to learn. So, just put your best answer forward. Awesome. Okay, we'll end it there.
Perfect. Okay, so 70% of you said it's a myth, and 30% said that it's a fact. So it is indeed a myth. So this is actually a very bad habit to do, and we do not, as pelvic floor physios, recommend practicing your Kegels this way. And the reason for this is when we are peeing on the toilet, our pelvic floor muscles need to be completely relaxed. Remember, I said that they're sphincter, right? So that sphincter needs to be relaxed in order for all your urine to come out. So when you're sitting on the toilet and you're now training your pelvic floor muscles to tighten, and relax, you're now training those muscles to tighten in a time when they need to be relaxed. This tightening over time will lead to incomplete emptying of the bladder because it's so tight now and tense. And if you're not emptying your bladder, this can lead to frequent urinary tract infections. So for this reason, we do not recommend that you practice your Kegels on the toilet. Okay, so our next condition is pelvic organ prolapse. So remember when I said that the pelvic floor muscles are a basket of muscles and they are holding our organs inside. So as you can see here, if you look at the diagram on the slides, the red line at the bottom is your pelvic floor muscles, your bladder is the yellow, Your uterus is the purple and your bowels are the gray. So the pelvic floor muscles are holding these organs inside. Now, when the pelvic floor muscles, that basket starts to weaken, those muscles are going to start to sag. And when they sag, your organs now that are inside are going to start to sag with it. And what happens is now they can actually protrude through the vaginal walls. So a lot of symptoms that women will experience is heaviness or pressure that is in their pelvic region that is aggravated by standing, by exercising. It's relieved when they lie down. They might feel a lump or a bulge. They may feel like something's literally falling out of their vagina. They may have pain with intercourse. Their bladders may not empty. They may have a weak urine stream. They may have frequent urinary tract infections. Maybe they have difficulty emptying their bowels. So in this slide, this is just kind of to give you a visual of what is happening. So the first one here on the left, this is kind of the normal anatomy. So bladder, uterus, rectum. To the right, when we have a bladder prolapse, we call this a cystocele, and that's where the bladder starts to poke through the vaginal walls. We can have a rectocele, so the rectum is poking through. If your uterus is poking through, that's a uterine prolapse, and we can have a vaginal vault prolapse. So this is common after a hysterectomy has been done, and there's changes in hormones, changes to the tissues, the strength of the pelvic floor muscles may weaken, and so those tissues start to poke through the vaginal wall. And we have a grading system. So first degree is descending a little bit. Second degree, it descends to the opening. Third degree, it's going past the opening. Fourth degree, it's totally inverted. So again, we have grade 1 level evidence that pelvic floor muscle training can help to bring your prolapse up by at least a grade or 2 and be symptom free. In the case that you're still having a lot of symptoms, the prolapse is really, really bad, there's other options like a pessary, which is a device that will hold your prolapse up, or surgery. Surgeries last about 10 to 15 years, and then you'll end up being back at square one. So we always recommend conservative physiotherapy first before considering other options. Okay, so we're going to talk about pregnancy and postpartum and how physiotherapy plays a role there. So in pregnancy, there's a lot of different things that a woman can experience. So they may have pain in their pubic bone, their groin, their back, their pelvis, their tailbone, their ribs. They may have sciatic pain shooting down the leg. They may be experiencing a little bit of incontinence. They may have an abdominal diastasis. So that's kind of a bulge in the abdomen. We'll talk about that in a bit more detail coming up. Maybe they're experiencing pressure or heaviness in their pelvic floor area. They may have symptoms when they're exercising. So these are just some examples of things that we can experience when we're pregnant. And if you are, these issues should be addressed during pregnancy because they can continue to worsen as your pregnancy continues, and they can continue to linger into postpartum. So if you are having any of these symptoms, we should get them addressed right away and not hope that, once you're not pregnant, they're going to go away on their own. So here is just a quick slide on some different types of pain during pregnancy. So we have round ligament pain, which is pain on the sides of the belly. You may have that sciatic pain, that pubic pain, so we call that lightning crotch. And then you may have maybe neck pain, shoulder pain, because your posture is changing. So again, all these things can be addressed through pelvic floor physio. All right, so let's talk about an abdominal diastasis. Some of you may have heard of this. Some of you may have this and not know what it is. So as the belly grows and grows and grows during pregnancy, sometimes the tissues and the abdomen, the abdominal wall, the tissues get thinned out. Okay, so if you look at the picture here where I'm circling, you have your abdominals on the side, and in the middle is your linea alba. So that linea alba can actually thin out and cause the tissues to kind of spread apart. And then you end up with what we call the diastasis. So you have like a gap in between your abdominal wall. So some signs of this are you notice that there's a gap and you can actually stick 2 to 3 fingers in that gap in towards your belly. You might notice when you're trying to use your muscles, you have a bulging or a tenting in the middle of the abdomen. So if you look at the picture here on the right, that's that bulging that I'm talking about. Some women will complain that they're 1 year, 2 years out, and they still look pregnant. Their abdomens are still distended. So this abdominal diastasis can occur, usually we'll see it in the last half of pregnancy as the belly has grown a lot more. And a lot of times it's actually seen after pregnancy once the abdominal wall is lax. So through pelvic floor physio, we can work on strengthening the pelvic floor and the inner abdominals to close that gap and prevent the abdominal wall from looking very distended. And it's never too late to work on this. So even if you're 10 years, 20 years postpartum or more, we can strengthen these muscles. Any muscle that can be weakened can also be strengthened. So just keep that in mind. So during pregnancy, when it's a good time to come in is during the second trimester. So this is going to be at your 20-week mark, and if you're not a high-risk pregnancy. At this point, you'll come in, we'll address the state of the pelvic floor muscles and the abdominals, address any symptoms that you may be experiencing, and give you some safe exercises to do during your pregnancy. At this point, you may have just 1 or 2 visits, and then off you go, and you'll come back at 34 weeks. If you're having more symptoms or you're having pain or there's other things going on, you'll obviously need more sessions at that point. And then at the 34-week mark, we do labor preparation. So this is where we're doing perineal massages to minimize tearing and episiotomies. And I'm going to talk about that on the next slide. We also do a lot of education, how to breathe, how to push during labor, what are some optimal labor positions, because I'll tell you this, lying on your back like they do in the movies is not how you do it. And then we'll talk about early postpartum recommendations for both vaginal and C-sections. Okay, so perineal tears. 44 to 75% of women will have some degree of tearing during a vaginal birth. So if you look at my diagram here on the left, so a grade 1 is that the pelvic floor muscles will not tear. A grade 2, you'll have a little bit of tearing into the pelvic floor muscles. Grade 3, that tear will go down towards the anus, and a grade 4, it tears into the anus. When your birth provider can predict that maybe a grade 3 or 4 is about to happen, they may perform an episiotomy. And that is where they will go in and cut on an angle away from the anus and cut the tissues there to prevent you from tearing down towards the anus. So in order to prevent a grade 3-4 tear and episiotomy, what we do is the perineal massages. So what that is, so looking at my pelvis here, so in between the opening of the vaginal walls and the anus, this is called your perineum, and this is the area that we will stretch and massage in order to prevent tearing from happening. Now, at that 34-week mark, you'll come in 2 times a week until you deliver. And we will also teach the client how to do that massaging as well as their partners so it can be done daily. Just a side note, perineal massages are also used for relaxing tension in the pelvic floor. If you have pain with intercourse or any other pelvic pain, if you do have scar tissue because you did have some tearing, then we work on doing some massages with that as well. Okay, so heading into postpartum, again, we're seeing some of the same things that might come up. Maybe you have new or ongoing pain in those same areas. You may have now noticed there's some incontinence. Maybe now you're noticing there's a diastasis. Maybe you're feeling pressure or heaviness and a prolapse might be happening. Maybe now you have pain with intercourse that you didn't have before. If you've had a C-section, you may have scar pain, sensitivity, or numbness. You may have vaginal pain from tearing or from episiotomy scars. So the earliest that we will see clients after they've had their babies is 6 weeks post-delivery, and they're cleared from their birth providers. Okay, so we have another poll. So myth or a fact, having an elective C-section will spare your pelvic floor from any dysfunction. And by elective, it means that you know you're going in for a C-section and it wasn't an emergency C-section. All right. Everybody seems to be getting the correct answer so far. All right. Perfect. Okay. So the answer is indeed a myth. So no matter how you give birth, your pelvic floor can be affected from the pregnancy itself. So it's the weight of the baby that places that downward pressure onto your pelvic floor. And that's what can lead to a prolapse. That's what can lead to incontinence or changes to the tone in your pelvic floor. You may have a diastasis, which has nothing to do with a vaginal delivery or a C-section delivery. So it is indeed a myth, and having a C-section will not spare your pelvic floor. So another important aspect that we take care of during postpartum is C-section scar care. So some women will complain that they have pain, they have tightness, they have sensitivity, pulling, itchiness, numbness in that scar. There may be a restriction in the scar that leads to tightness in the abdomen or low back pain. So a lot of our treatment is going to work on desensitizing the area. We do scar massages to improve tissue mobility, and we do abdominal re-strengthening. In a C-section, the abdomen is cut through 7 different layers of tissue, and that's 7 different layers that they now have to sew back up. So there is so much opportunity for scar tissue to build and for weakness to occur in the abdomen. So therefore, it's really important that we attend to the scar and re-strengthen those muscles. Okay, another poll. Myth or fact, women receive the same amount of care by their birth providers in postpartum as they do during pregnancy. What do you guys think? Is the poll up? Yeah. It's coming, it's coming. There we go. Perfect.
There we go.
There we go. All right, so.
You guys are getting quicker at voting. Everyone's more decisive as we start to learn more.
Exactly, exactly. Okay, I think, oh, still coming in. Okay, perfect. So you guys all said, or most of you said, it's a myth. That is correct. So prenatally, women will get on average about 14 visits with their birth providers. In postpartum, your baby will get about 8 visits. The mom in postpartum will get 1, maybe 2 if you're lucky. And many times, that's during pre-COVID. During COVID now, I've been hearing that they're only getting a phone consult or a virtual visit. So really, what care is happening here by a phone call? Nothing's getting looked at. Nothing is getting assessed. So we need to remember that postpartum is forever. Women need more care in this phase of life. We call this the 4th trimester. So care shouldn't stop as soon as you deliver your baby. By addressing any dysfunctions or any problems now is going to help to prevent any problems from occurring 2 to 3 decades away from now. And just a side little fact, in France and in Europe, every woman that gives birth is offered 6 free pelvic floor physiotherapy sessions. I mean, come on, that's amazing. And it's so unfortunate that we don't have that here yet. But I am hopeful that one day we will get on board with that in our healthcare system here. But anyway, moving on. So now we're moving down to the 2 to 3 decades later. You may be heading into menopause. So what we have here is a syndrome called genitourinary syndrome of menopause. And all that means is that it's a collection of signs and symptoms associated with the natural decrease of estrogen that involves changes to the pelvic floor and the vaginal tissues in your bladder. So estrogen helps with lubrication, blood flow, and the overall health of your vaginal tissues. So as our estrogen starts to naturally decrease, this can lead to vaginal atrophy. So I have a diagram here. So on the left side here, we have our ovaries. They're producing estrogen. The vaginal lining is thick and moist. There's blood flow going in. The walls are elastic. There's recoil. There's bounce. The vaginal fluid is secreted. And then we go over to the right side, where now we're starting to lose that estrogen. So the lining now becomes thin and dry. There's less blood flow getting to the vaginal tissue. The vaginal elasticity decreases, so it's not as elastic and it can't recoil. It doesn't have that bounce anymore. It gets stiffer. There's less secretion of fluids, and the vaginal canal actually narrows and shortens. So this is basically a summary of what I said. We have reduced blood flow, reduced lubrication, decreased elasticity, narrowing, shortening of the vaginal canal. So all these changes that are happening can lead to the following symptoms. You may be experiencing vaginal dryness, burning and irritation, bleeding after intercourse. Maybe it hurts just to touch the area. You may have pain with intercourse now, maybe loss of libido. You might notice your pelvic floor muscles are getting weaker. You may have some urinary symptoms coming up. And maybe one day you're going to wake up and all of a sudden you feel something falling out of your vagina and you have a prolapse. Some women will experience 0 of these symptoms. Some may experience a few, and some may experience many of them. Everybody is different, but the bottom line is that these issues can be addressed through pelvic floor physio to help you feel like yourself again. Okay, our last myth or fact. Women who battle breast cancer go through incredibly challenging physical changes during treatment, including side effects on their vaginal tissues and pelvic floors. What do you guys think?
I'm sorry, I'm very slow on the polls today.
No worries, no worries.
Okay. There we go.
Perfect. Okay, all right. There we go. So most of you said fact, and that's amazing because that is true. So many forms of breast cancer are estrogen producing, are estrogen positive cancers. So treatment is going to include medication that blocks the reception of estrogen. Therefore, you're going to have a decrease in estrogen, and that can lead to all the same symptoms that I just talked about in the previous slide. So my point of bringing this up is that breast cancer patients may need pelvic physiotherapy as well and can benefit from pelvic physiotherapy. Perfect. Okay. All right, so let's talk about what an assessment looks like. So first off, it can definitely be very intimidating. A lot of women come in really, really nervous. They don't know what to expect. So I'll walk you through it. First off, we're going to go through a thorough medical history, including your current symptoms and concerns. Everything we talk about it stays in that room. It's going to be a one-to-one. We're in a private treatment room. Everything we talk about is private. we'll then go through a complete external assessment. So we might be looking at your posture, your strength, your low back, your pelvis, the muscles in the area that all could be contributing to your symptoms. And then we'll do a complete internal assessment. So that is where we go in vaginally, sometimes rectally, and we assess the pelvic floor muscles for tension, strength, and tenderness, and trying to see what could be causing your symptoms. A big question that I get often is, do we use speculums? So speculums are those plastic or metal devices that they put inside when you get a pap smear that the doctors use. And the answer is a big fat no. We do not use speculums. We use just our 2 fingers. It's very, very gentle, and it's a lot more comfortable than how the doctors would handle it. So the most important thing that I want to let you guys know is that when you come in for an assessment, my number 1 priority is to make you feel comfortable, respected, and heard. We do everything at your own pace. Everything's done with your consent. And I always just try to make you feel comfortable first, and we worry about the rest later. So if you're nervous about coming in, I really hope that you won't be, and I promise you by the end, you'll be laughing and be like, oh, it's not that bad. But anyway, moving on. So in terms of treatment, it's going to be based on what we find in the assessment. Everyone's going to have a different issue. So we have individualized treatment plans, and that can include some different type of pelvic floor exercise routine. So either we're strengthening or we're relaxing those muscles. There's a lot of education involved, behavioral, lifestyle modifications. We do a lot of bladder retraining, and we do a lot of manual therapy. So we do a lot of internal and external techniques. All right. So that's bringing us close to the end. So my take-home message is that you should not have bladder or bowel leakage. You should not feel a pressure or heaviness in your pelvic region. You should not have pain with intercourse. And Kegels are not always the answer. Pelvic floor dysfunctions can happen at any age and can be treated at any age. So it is a misconception to think that these are signs of getting older, or this is because you had a baby, so this is normal. This isn't normal. These can all be treated. And if you do have any of these symptoms, I really hope that you do seek out pelvic floor physio, because it can be life-changing. All right, so prior to the webinar, I had a lot of people reach out to me, and we talked about personal questions that they had. So I just want to extend this offer out to everybody here in the webinar. So I'm offering free 15-minute consultations. So whether that's by phone, virtual, or email, whatever is comfortable for you. You can type in the chat box if you want me to reach out to you, and you can type in phone, virtual, email, whatever you prefer, and I will get in contact with you in the coming future. Okay, and my email's there, and you can find me at Nobleton Physio. And so just before we take questions, I just want to introduce our next webinar. So we have the Survival Guide to Low Back Pain. It's going to be presented by Mike and Alex from Aurora Sports Med. It's going to be December 16 at 7:30 p.m. So if you're interested in that, watch out for the emails that will be sent out. And if you're not sticking around for questions, I just want to thank you guys all for joining, and I hope that you guys learned a lot about the pelvic floor. All right.
Thank you so much, Nadine. That was honestly a fantastic presentation and like super informative. And I just want to say, like, I totally agree. I think sometimes these topics are a little bit taboo for women to talk about, and people are nervous to kind of get these things looked at, and they just think it's normal. And the fact that you're so like willing to be comforting and just make sure everyone's comfortable is really helpful to women to go seek out help for these issues that they're having.
Yeah, for sure.
So anyway, yeah, thank you so much for everyone. We'll get into the Q&A here. There was quite a few questions. I tackled some of them in the Q&A, but some that I think will be appropriate for everyone. I'll just start a few here. So one of the things that came up is, when is the best time to get an assessment and start treatment when pregnant, and which trimester?
Okay, so I did answer that. So the best time to come in is during the second trimester, approximately at that 20-week mark. And we want to make sure that you're not a high-risk pregnancy. Is that the full question?
Yep, that's perfect.
Yeah. Yeah.
Okay, next question is, how can you tell the difference between a bladder prolapse or a uterus prolapse? And I'm not sure if this is from the perspective of the therapist or the patient or both, but whatever you can speak to may be helpful.
Okay, so when we are assessing for a prolapse, it's going to depend on where we see it protruding from. So if it's more, I don't know if it would work on my, let me go back to the slide where the picture is. Okay, oh, passed it. Oh no, too fast, sorry. There we go. Okay, so when we are kind of looking to see when the prolapse is just protruding, if it's more anterior from the top, we can tell that it's coming more from your bladder. If it's more kind of in between, we can tell that it's your uterus. And if it's coming more from the posterior, so the bottom of the vaginal walls, we can see that it's a rectocele. It's going to be really hard for you to assess on yourself. So if you're trying to use a mirror, it's very confusing. You will not really know what you're looking at, but because we know our anatomy, we can kind of pinpoint it a little bit better. But basically, it's just based on the position of where it is and which wall it's kind of bordering, if that makes sense.
Yeah, awesome. Thank you. Okay, so someone wondering about how long after a C-section, or is it does it ever get too late, or has it been too many years for someone to come seek out pelvic floor physio?
Never too late. Everything that I've talked about here can be treated at any point in time and in life. It is never too late. So after a C-section, typically we want to see you again at that 6-week mark. We can start working on the incision once it's healed, and that incision will heal within 4 to 6 weeks if there hasn't been any complications. So there hasn't been any infections and it's healed quite well. And before you come in, we can teach you. So before you have that C-section, we can teach you how to start desensitizing and massaging the tissues prior to you coming in, because we can start by working around the incision. And then when it heals, we can start to work on top of the incision. So really, if you know how prior to coming in, you'll want to start there. And then once it's healed and you're at your 6 weeks, you can come in for physio and we can start treating it together at that point.
Awesome. Thank you, Nadine. So the questions are pouring in, so I'm trying to kind of filter and apply what's relevant for everyone. So I think this is a good question. I know you were talking about with intercourse, especially after menopause, you can get vaginal tearing happen. Someone is wondering if there's any general recommendations for this, or if it's more of like something that should be treated on an individual basis.
So it's going to be definitely on an individual basis. If there is some vaginal tearing and those tissues are thinning out, likely you're going to need some form of cream. So whether a natural cream, a moisturizer for the vagina is enough, that you can use that every 2 to 3 days, that will help. In some cases, it may not be enough, and you might need to go back to your doctor for some estrogen cream. It depends if you're okay with the hormones or not, but that estrogen cream will also help give you a little bit more of that lubrication to the tissues. So again, it's going to be on an individual basis for sure.
Perfect. Thank you. I thought this to be an interesting question. If you know if abstinence contributes to weak pelvic floor.
That is a good question. I don't think so. I don't think that it's going to have a major effect. No, that's my opinion. I don't know what the research is on that, but I don't think that if you never had intercourse, that it's going to mean you have a weak pelvic floor. I don't believe that.
Awesome. We'll just do a couple more here, Nadine, because I know you must be getting tired.
Okay, it's okay.
Would this be, oh, sorry. So you spoke about a teaching partner regarding the massage techniques. Is that something you would recommend for the partner to attend the session as well to learn?
Yeah, for sure. We always welcome partners to come in. So when we go through the massages, obviously I will teach the client how to do it, and it's up to them and how comfortable they are doing it themselves and whether or not they want their partners to do it. So they can either take that information, teach their partners themselves. If their partners want to come in, they're more than welcome to, and we can go through it step by step together. Some women are just like, nope, I don't want to do it. I don't, and sometimes in pregnancy, it's hard because your belly's so big, it's even hard to reach down there. And so they prefer us to just do it or for their partner to just do it. But we are more than happy to teach the partners to do the massages as well.
Awesome. So I'm just kind of scanning through here. I think a lot of the questions do pertain to individual cases. So I would encourage you guys that if you do have a problem, there's not necessarily like a general treatment for each type of condition. It is really best that each person is assessed individually because we all are a little bit different and may need different exercises and techniques to help us. So if these are questions you have, I really would urge you to reach out to Nadine and take advantage of the 15-minute consultation and see if it's a problem that we would be able to help you with. The last question I will put out, because I think it's relevant to everyone, is just about pelvic physiotherapy and if it would fall under any private insurance coverage, if you know that, Nadine.
Exactly. So pelvic floor physio goes under your regular physio benefits. It's not a separate category. So as long as you have coverage for regular physiotherapy, pelvic physio is covered.
Awesome. And lastly, would it be helpful for someone who's had a catheter?
Yeah, yep. So the catheter will kind of tug on those muscles and it irritates the muscles. And so a lot of times they need to be kind of re-strengthened. They need to be woken up. They may need to be massaged because those muscles get kind of tense and they don't like that they were in a catheter. So definitely, yes, we can for sure help with that.
Okay, awesome. I'm just doing kind of one final scan here. I think we've talked a little bit about vaginal dryness and lubricant. We were talking about some moisturizers. Anything else you have to add on that topic?
Sorry, can you repeat that question?
Just addressing, again, like vaginal dryness or lubricant, daily or intercourse, if you have a recommendation for that.
Okay, so for vaginal dryness, there are some creams out there that you can use. They're like suppositories that you put up and it helps to moisturize the area. The other option are estrogen-based creams that will help with that to reduce kind of the dryness and restore the tissues. Yeah, sorry, was that the question? It was a little confusing.
Yeah, I think that's good. Yeah. Okay, awesome. There's lots more here. It's obviously hard to get to everyone's questions. If you see anything that you're scanning there, Nadine, that you want to address to the group.
Yeah, so here I see a question. Do men have to strengthen their pelvic floor? So yes, men have pelvic floors too. They are a little bit luckier than women that they're less likely to have pelvic floor dysfunctions, but it doesn't mean they can't have it. So if men might experience the same kind of incontinence issues, urgency, frequency, they may have pain with intercourse, pain with ejaculation. If they've had prostate issues or had their prostates removed, these can all lead to pelvic floor problems. And so, yes, they can definitely strengthen those muscles as well.
Awesome.
Yeah, so let's see.
I hear about how to retrain the bladder. To me, I interpret that as potentially like an overactive bladder. I'm not sure if that's what we're referring to here.
Which question is that?
It's just how do you retrain the bladder?
Okay, so retraining the bladder is going to depend on the type of urgency or frequency, or is it stress incontinence? It's going to depend on what is going on with if you have incontinence. And then the bladder, in order to train it itself, we do something that we call bladder retraining. So you have to remember that the bladder and the mind connect together, and it's a reflex system. So we can train it through just basic behavioral modifications. We tell you how and when to go to the bathroom. You're going to do pelvic floor exercises to start strengthening the muscles. So there's so many different ways. It's just going to depend what you're coming in for and which kind of issue you have. But a lot of it is just like straight behavioral changes and trying to get you within that norm of what's considered a normal bladder habit.
Awesome. Thank you.
So I see here can a weak pelvic floor impact orgasms? And it can, because if you are not able to contract your pelvic floors strongly enough, you might not have a lot of feeling in there because the muscles are weak and they're not contracting. So definitely it can impact orgasms for sure. Yep. Let's see what else. Can pelvic floor exercises by itself solve issues, or does it have to be a combination with medications? So depends on what you're coming in for. So what are your pelvic floor issues? So a lot of them can be addressed through just pelvic floor exercises, some manual techniques. It doesn't have to include medications or creams. That's typically only if there's some dryness or some itchiness or there's something else going on in the area. But typically we don't recommend a lot of creams or medications or anything like that. A lot of it is exercise based and manual based. So using our hands, our fingers to massage, stretch those pelvic floor muscles depending on what they need.
We've got one here just about pelvic floor physio contributing to menopause treatment to reduce dryness and increase elasticity and restore premenopausal state. So how would pelvic floor physio help with that?
Okay, so going back, so I think we've kind of answered this one a few times. So to reduce the dryness and kind of restore the tissues again is through certain moisturizers that we can use, through estrogen creams, and through pelvic floor exercises. So believe it or not, by doing pelvic floor exercises, you're going to bring more blood flow and circulation to that area, and those will typically help with your symptoms. A lot of times having intercourse, because intercourse is going to help bring blood flow circulation to that area as well. So that's generally kind of the treatment that we can go by to help with those tissues. But again, it's all going to depend on an individual basis. What are you presenting with?
Awesome. And any recommendations, steps to prepare to conceive?
Not necessarily. I mean, I think it's having a strong or a weak pelvic floor isn't necessarily going to stop you from getting pregnant. It's kind of the state of your pelvic floor after that. So what's happening there? How do we make sure that they're strong or weak to maintain that pregnancy and in postpartum? But it doesn't have like a super big effect in terms of getting you pregnant.
Awesome. Anything else you see there, Nadine?
So here is, what is the frequency of pelvic exercises? How much time do we need to see or need to give before results are seen? So that's actually a really good question. So again, it's going to depend on what you're coming in with and where you're starting in terms of your strength. But for the most part, the exercises can take weeks to months till you start seeing a difference. You have to be doing your exercises daily, every day. You got to keep on top of it. And within, 4 to 6 weeks is where you're going to start to notice a little bit of differences. And if you're really, really on top of it, you'll start to really see big changes within, 6 to 8 weeks to 12 weeks. But again, it's going to depend on where you start on that spectrum and how diligent you are with your exercises, for sure.
Awesome. I think we're down to the last couple of questions here. Pee urgency accompanied with a bit of urine. Why?
So that is going to be a little bit of so as I talked about, so with urgency, so you have to run to the bathroom, you can't hold it in, and you get that little bit of leakage. Typically, that can be due to that hypertonic or tight pelvic floor muscles. So what happens is when you have your pelvic floor muscles, they will contract and they will relax. When they are tight, they will stay in this tonic position. And when you are trying to activate them, they will not be able to generate enough force to do their job because they're already tight. So with urgency, you get that dribbling because those muscles are overactive. They can't do their job. They cannot help the bladder. And so when you have that urgency and you have to run, you're going to get leakage because these muscles just aren't functioning well. And that's due to being overactive in those muscles.
Awesome. And here someone's asking, just in terms of proper Kegels, what types of cues will work for how to do a proper Kegel?
So very basic. I mean, it requires a lot of cueing and kind of mental imagery, but basically what you want to do, the sequence is you want to inhale and you want to do diaphragmatic breathing. So you're breathing through your belly, not through your chest. And you're going to inhale. And at that point, you're going to exhale. And as you exhale, you're going to think of squeezing your pelvic floor muscles, which means if you are trying to pee, you want to maybe squeeze those muscles. Or another thing you could think of is try to pick up a marble in your vagina. Try to pick up that blueberry, hold that, and then you're going to relax. So you breathe in, breathe out, squeeze those muscles, and relax. But it's very important that you're not squeezing too hard, that your glutes are kicking in, your legs are shaking, you're not over recruiting other muscles. So it's easier to kind of have you do it in person and to feel what's going on to really make sure you're doing it right. Hope that makes sense.
Awesome. Can mental health and stress cause pelvic dysfunction?
Yes. So mental health, stress, anxiety, depression, all of those symptoms cause our bodies and our pelvic floors to tense up. And we will end up carrying a lot of tension in our pelvic floors. And that will lead to that hypertonic, overactive pelvic floor, which can spiral into different things, your pelvic pain, pain with intercourse, constipation, dribbling, leakage. It can go anywhere from there. So when we do address a lot of these issues, a lot of our questionnaires that when you come in is we're looking at, do you have high anxiety, stress, depression? Is that a part of your life? Because addressing those issues will help us to address the pelvic floor dysfunction as well.
Awesome. 30-year-old with pelvic tension, is it common for minor bleeding post-intercourse?
Is it common for minor bleeding post-intercourse? I wouldn't say it's super common, but I definitely think that it is possible to happen, and that's going to come down to what's happening in your tissues. Why is there that pain? Why is it bleeding? And is there some hormonal issues going on? Is it that the vaginal canal can't accommodate and there's a lot of friction going on? So we would have to kind of assess and kind of look at the big picture of why that might be happening in order to kind of fix it and see where we can go from there. But definitely, it can definitely be addressed. So it can be helped. Okay, lots of questions, guys. Oh, wow. Okay, so another one is, can we do pelvic floor exercises when there is severe low back pain? So one of the things I talked about was, again, having that hypertonic pelvic floor. And research shows that many people who have that chronic severe low back pain actually have pelvic floor dysfunctions. And most of the time it's because their pelvic floors are hypertonic. So the clear answer is that if you're having severe severe low back pain, then I would probably not recommend to do Kegels, and I would definitely get it assessed to see what's causing your back pain, where is it coming from, and determine the state of your pelvic floor muscles if they're tight or weak. Okay, so next question. Can the pelvic floor cause more chances for gas release? So actually, the pelvic floor it's a sphincter, right? So it holds in, it lets go, whether it's our urine, our gas, our bowels. So if you're having that gas release that you can't control, then you need to strengthen your pelvic floor muscles. By having them stronger, it's going to prevent that release of gas from happening on its own without your control. It won't cause it to happen. It's going to help it from happening, if that makes sense. So I don't see any more questions. I do see a question here about my schedule in the clinic and my availability. So I'm in Nobleton Physiotherapy on Mondays, Tuesdays, Thursdays, and Fridays. Mondays and Thursdays, I am there in the evenings, afternoon to evenings. Tuesdays and Fridays, I'm there in the mornings to the afternoons. And in terms of availability, well, you got to call the clinic and find out because I don't know it off the top of my head. But it is a busy time right now. So if you're trying to get in, especially before your benefits run out, I definitely suggest booking in early.
Awesome. Okay. Great job, Nadine. Thank you again so much. That presentation was fantastic. And I think everyone learned so much from it just based on the chat. It seems like it was super informative. So yeah, thank you so much. All right, we've saved the chat. And so if you've typed in the chat for Nadine to reach out, she will certainly be doing that. So I hope you guys enjoyed, and we'll be in touch with you all soon. So have an awesome night, guys.
All right. Thanks, guys. Thanks for coming. Hope you all enjoyed it. And if you do change your mind or you do want to get in touch, we will be sending out a survey in the next few days, and you can always let me know there. Again, if you change your mind and you do want me to reach out or you do have questions that you thought of. So don't worry, we can always be in touch. All right. Thank you guys all for joining. I hope you learned a lot. And until the next webinar, we'll see you then.
Low back pain in about 6 weeks. Okay.
Yeah.
Have a good one.
All right. Bye.